morning, everyone, and welcome back for day 2 of our 2022 Medicare Advantage Summit. And if you're joining us for the first time today, and for those I've not met yet, this isn't the voice that I normally carry. I have a little bit of a cold that I'm carrying, but I continue to have the same excitement that I had yesterday. On the second day of the summit, we're looking forward to the future of MA, and that's what you'll be hearing from our speakers and the panels. And we're going to be kicking off with discussions about innovations that are taking hold in the program and the possibilities and the potential that lay ahead. And there's no surprise then why we have Dr. Liz Fowler, who we'll be speaking with this morning, and I'll have the opportunity to introduce her in just a bit. This has been a full circle moment for me, and as we talk about the future of MA, as the Chief of Staff at HHS 25 years ago, in the earlier days of MA, when it was Medicare plus choice, I had a front row seat to the program's launch when it became law. And I was with many of you in this room at that time, and I look at Vicki Shepard here in the second row, who was at HHS with me at that time. That is when Medicare plus choice was put into law with a Republican-led Congress and a Democratic-led administration. And we've seen so much in Medicare Advantage since that time. There were many hopes for the program, and I believe that many of those hopes have been delivered on and have gone beyond and have become the fabric of the program today. As we see now, Medicare Advantage is serving 29 million seniors, individuals and with disabilities as well. And right now we're seeing projections from CMS that see that enrollment could increase to nearly 32 million beneficiaries by the end of next year. And that's with the innovations that so many of you are seeing because of the work that you all are doing with the stakeholders and beneficiaries. And those innovations speak for themselves. Just recently, we had the 2022 State of Medicare Advantage report that we released. And between 2021 and 2022, there were so many different benefits that were showing some of that evidence. Nutritional benefit offerings in Medicare Advantage showed increases of 327%. Transportation for non-medical need benefits increased by over 100%. In-home support services increased by 83%. And caregiver support beneficiary offerings increased over 60%. And those are just examples. And again, it's so exciting that so much of our MA community is here today and going to be joining us later today who are in that space working with beneficiaries who are receiving those benefits. Over the course of the events today, we want to be able to talk about how we're going to build off of those benefits and where we need to build even more and improve upon that. Again, I want to just thank the speakers who are with us today who are going to be part of that task of building. We're going to have panel discussions and breakout sessions. I want to recognize some of those panels. One of them is going to be focusing on value-based insurance. I know Mark Fendrick is here. Hi, Mark. And we're going to be talking about unmet needs and improving care delivery. We're also going to be treated to a spotlight on innovation with the COO of Health at Scale, a company that is using machine learning and AI, artificial intelligence to match patients and providers. So I'm hoping that I'm going to be at that one. And then we're going to have a panel discussion on the future of healthcare. And I'm excited to be able to listen to friends and former colleagues, Bill Hoagland and Chris Jennings, who are going to be representing the various views of the future of healthcare. And then, as I mentioned, we're going to have breakout sessions. So I'm going to quickly transition to an introduction of someone who many of you have worked with over her decade career, and I am so fortunate to have benefited from both working with her and also being able to call her a friend. And I was just joking, saying, I'm so looking forward to our fireside chat, but I also would just love to be able to just have a personal fireside chat with her, and that's Dr. Liz Fowler. And there's really, Liz is Jen, as I refer to her informally as Liz, Dr. Fowler is a model public servant, and as you are in your day-to-day work and personal professional lives, and you hear people who are talking about the work that is going on in DC, and I know often there is sometimes cynicism about the partisanship or work that isn't going on. I often think of the public servants that are doing the work that is making a difference in policy making, and Dr. Liz Fowler is that person who is at the helm of leadership and getting work done. And any kind of introduction that I do of Dr. Fowler is, it has to start with that example, and I see heads nodding. So before I get into an official introduction, I just needed to recognize the model public servant that she is, and just sets the bar, and just how grateful we are that she stepped into the administration once again. Dr. Fowler has worn many different hats, and recently she served as the Executive Vice President at the Commonwealth Fund, and she was also a Vice President for Global Health Policy at J&J. As I mentioned, she served in a previous administration as President Obama's Healthcare and Economic Policy Advisor at the National Economic Council from 2008 to 2010. She also was the Chief Health Counsel in the legislative branch working with Senator Baucus, and that's when they were developing the Senate version of the Affordable Care Act. And she also, not just on the Affordable Care Act, but she also played a key role in the 2003 prescription drug, I'm sorry, my cold is getting into me talking, the Improvement and Modernization Act. She has over 2 decades of health policy experience, and there's no wonder just, I think yesterday or at some point this week, I'm not caught up in the news, it's no surprise she's the newest member of the National Academy of Medicine, and she's also a member of the Aspen Fellows. She has a PhD from Johns Hopkins, which is why I'm referring to her as Dr. Fowler, which is just hard when you have a friend and you're referring to her with that official title. And she's also a member of the Aspen Global Leadership.